Hi, how are you? My name is Dr. Clement Liu. I'm a chiropractor and acupuncturist. Today, we will be talking about spinal stenosis and 5 important exercises that you can do at home yourself. They're very simple, and let's get going. Spinal stenosis actually is a condition whereby the spinal canal is narrowed and sometimes can cause pinching of your cord, or sometimes if it's a lateral stenosis, um, the foramen here, or the hole on the outside where these nerves come out, can be enclosed and cause symptoms down the leg, sometimes cause weakness, or sometimes cause muscle wasting, numbness, etc. So let's go with the first exercise. First simple exercise you can do, we should be sitting. Today we'll be going over a lot of seated exercises, simple for a majority of you to do. If you have anything in front of you, a tabletop, I have a chair here. What you're going to do is just a simple cat camel stretch. What we're going to do is take a deep breath in, look down, and round our back out. And hold a little bit and relax back up. Okay. So we're going to look down now. What's going to happen, you're going to round your mid back. Your lower back actually is going to be in a slight flexion. With the slight flexion, that's going to open up your spinal canal to allow the nerve to be more free. And then we're going to come back up. You can try and do a series of 8 sessions, 8 series of these. 3. Let's try and breathe normally. 4. Don't hold your breath. A lot of people tend to hold their breath when they're doing this. 5. Okay. When you're coming back up, try and look straight. Try not to hyperextend your back, because if you hyperextend your back, that's going to create the pain for some of you. Let's look down again. 6, 7, and 8. Very good. Another way you can do this is what we call sit and reach. So sit and reach, we're going to apply a little traction on your spine with a little flexion. So what we're going to do is making sure both feet are flat on the floor. Find a surface, your tabletop, your countertop, and lean forward. And apply a little traction stretch, a little flexion, and breathe out. And breathe in. And we're going to hold these stretches for around 10-15 seconds or so, and then let go. Okay. If you have symptoms on both legs, this is one of the stretches you can do. Let's say you have symptoms on one of the legs. We can stretch, open up the foramen on that side by laterally flexing to the other side. So let's say we have symptoms down the right leg. What we can do is reach to the left side and opening up and applying some traction onto our lower back that way. Okay. And come back up. Let's say we have symptoms on our left leg, so we're going to do it the other side. So our body's going to lean towards our right side. So I'm going to hold here. All stretchers, try and hold at least for 10 seconds, 15 seconds if possible. If there's any symptoms recreation, like any numbness or any pain, stop doing these exercises and you should consult with your physiotherapist or chiropractor to see what other exercise that you should be doing instead. Okay. And come back up. Okay. 10 seconds, 10 to 15 second holds, do it at least for 5-6 times. Research has stated that any stretches, if they have accumulation of 60 seconds or more, there's an effect there. If it's less than 60 seconds, there may not be the same effect. Next, what we're going to do, we're going to do a simple pelvic tilt. So simple, it's simple to do, but then difficult to explain to a lot of people. What I usually tell people to do is try to put their hands on their hips. Okay? So what you're going to try and do first is draw your belly button in towards your back. When you draw your belly button in towards your back's going to flatten out. If you have a surface in the behind there, your back is going to actually touch that surface. Then you're going to bring it back. When you bring it back, pretend there is a string in your belly button and pulling your belly button forward, recreating that natural curve in your lower back. So when we're doing this, our hands are acting as a pivot. So when we're drawing our belly button back, our thumb in the back actually is going to drop down. We call that a posterior pelvic tilt. Then we're going to reverse that, the string pulling on your belly button forward, and your fingers, your index finger here, it's going to drop down. Your thumb is going to come up. Okay, let's try that a couple times. In and breathe out. What we're doing is allowing the spine to flex and extend. Flex and then extend. So creating some fluid, flushing out any inflammation sometimes in that region. So we're going to try it again. Both hands on the hips. Posterior tilt, then anterior tilt. When you're doing the anterior tilt, also try and think of a string pulling on top too. So you're actually not just drawing your belly button forward, but also bring your body up. Okay, so you're applying a little traction force along with restoring normal curvature. Again, you don't want your lower back to extend too much, because if you extend too much, that's going to increase your pain in your, especially if you have spinal stenosis. That's going to close up that hole. So again, posterior tilt, anterior tilt. Okay. The fourth exercise that we're going to be doing is simple, just marching, seated marches. So we're going to bring up left leg, slowly lower down. That's the point. What we're trying to do is engage muscles in the back. As you're slowly lowering the leg, you're actually activating a muscle that connects to the back. In and bring it in. When you bring it in, breathe in and relax it down. Okay? Do 10 of these. See? And if you notice, if you bring up the leg, you actually do cause a little bit of posterior tilt on your pelvis, and it tends to flex your back a little bit. That opens up again that spinal cord canal, the spinal canal. Okay, raise that leg in, up, 6, 7, slow down. What you shouldn't do is bring it up and drop it down. Okay. You want to slowly bring that leg down. 8, 9, and 10. Next, the last exercise I'm going to show you that is helpful for a lot of people, especially if you have lateral stenosis, meaning closure of the hole in the outside that catches onto your peripheral nerve. So you'll have one side of leg numbness, one side of leg weakness sometimes, what we call nerve flossing. What you can do, it's like flossing your teeth, right? So there's a nerve that runs from the back all the way down to your leg. What we're going to do is look up and straighten up that leg. And then look down, try and point your toes down to the floor and then draw it in, and look down with your neck. Try and do that a couple times. You're going to look up with your neck, straighten out that right leg, point your toes up to the sky. If you get symptoms by pointing up the toes in your sky, you can ignore that first, okay? And then bring it down. Some people will get numbness as you bring that toe up to the sky. Bring your neck, look up to the sky and bring that leg out and down. Make sure you're breathing. Anytime you hold your breath, that increases what we call your intra-abdominal pressure, and that can increase the load in your spinal cord and recreate more pain or aggravate the condition too. So try and breathe. Okay, so breathe in and out. Breathe in and out. Do another couple more times. At home, you should do at least 20 of these if you can. And slow. 2 more times. Okay. Very good. Hope that information helps. Again, if you have any symptoms that are recreated during these exercises, please consult with your physio or chiropractor to see whether or not these exercises are suitable for you. Thank you.